preparation slash evaluation slash, increasing mobility. Really getting your hands on the athlete, seeing how their shoulder moves, what tissues are tight or not, will help give you a good idea as to what you need to do. So the first thing I'm going to do is basically just mold this scap a little bit, just to see how that feels. And all of a sudden, I'm getting a lot of resistance anteriorly, right? So that's giving me some cues here, okay? I understand what needs to be done. Also, I'm gonna distract the scap here just to see how that feels. A lot of times the athlete really likes that. They think it feels really, really good. So I'll do that a few times just to, hit that mental aspect of the stretch. Sometimes if it's, if you're just able to pull that scap out, I'm not even gonna touch it that much. Yeah. The next thing I'm gonna do is just kind of see how this shoulder tracks in that joint by doing a little bit of, limited circumduction in both directions. Got my fingers on the joint, just seeing how it moves. Sometimes immediately here with the pitcher who's been pitching, an older guy, you'll hear or feel some cracking, some popping. Maybe the humerus is moving, a way it shouldn't. So you're like, all right, probably a little bit of instability in there. Probably needs a little bit more stabilization. Maybe some activation stuff pre-throw. Now I'm checking the bicep here. A little tight, right? A little tight. Get this in here. So that's something that I can go back to once I put this person supine, right? So now I've kind of identified that. I'm like, all right. So he's probably gonna need maybe some ART. If you guys know what ART is for that bicep, just hit that bicep a little bit, all right? He's already moving a little better. Come back up here, hit that lat. So I'm pinning. I'm gonna do this several ways because this is one of those ways that throwers tend to become most tight is in elevation. So I'm gonna pin this scap, the border of the scap here, and then just bring that arm overhead. Feel a stretch kind of right in there. He's tight. He's tight. So I'll mold that, a few times. See if I can get it to free up. Again, now I know, okay, I can do some ART for that lat. It's quick, doesn't need 30 minutes to do. Right when I'm supine, I can immediately just, do a couple of passes of ART and free up that elevation. Okay. Just movement here to grease it. Sometimes feels good, sometimes the athlete likes it, helps put the athlete at ease. And then I have him go supine. Supine for me. Some of this stuff, you're gearing up for a game. Sometimes guys are really jittery. So mixing in things like just the cracking of the knuckles here, help relax the athlete. Distracting here. Seeing what that feels like. Shaking. All right here, before I get into that overhead stuff, I'm gonna check the joint here just to see what that capsule feels like. So I'm gonna mold it in a couple of different directions, all right? Just to see what that feels like, all right? Feels all right, actually. Inferiorly is a little tight, but that's okay. So now I'm gonna go right to those things that I found. Let's have you flip around. So I'm gonna go right to ART of that, and immediately, that's tight. That's tight. So I'm gonna do some ART of that lat. Right, because if we're looking at it, this is kind of where his natural stopping point is, right? We want that to be here without any kind of compensation. So immediately I'm gonna start ART of that lat, just give it a few passes. Keep in there.
I thought I liked you.
So a little more free now, right? Yeah. checking crossbody, huge, right? These two, for me, are huge for the thrower. So making sure that they're at least similar to the non-throwing side. So sometimes what I'll do is just go immediately before I even start doing any of that stuff is checking what that looks like in the opposite side. He's got more motion, right? So ideally, you don't want to look at it through like a textbook lens where they say you have to have this amount of range of motion, especially if you're taking an individual, their left side's going to tell you what they need. So if their left side shows that they can get, overhead elevation to about the ear, I'm going to try and get the same on the right side, the throwing side, instead of trying to crank it to 180, Their anatomy that's how it is. So good. And then crossbody. So pretty good. He's a little tight though, coming across body a little bit. So his elbow is to about his cheek here on the right side. Let's see what it looks like on the left. Yeah, so that's about to the ear. So now I know posterior cuff probably needs a little bit of work. So immediately in my pre-pitch mobilization, once I get him prone, I'll have him do some stuff. So we'll first stretch internal rotation. You can do this several ways. Sometimes, guys need it, sometimes they don't. In this case, Tim's okay. One thing I don't like to do in a thrower too much is stress the medial elbow with an external rotation stretch pressing here. I like to just turn the arm and not go too crazy with external rotation, because they get so much external rotation as it is, their loss is going to be into internal rotation. So I'll just check both directions, and then if they need a little bit, I may do it just to almost like lubricate it. If not, go right into internal rotation. Like I said, you can do this a couple of ways. One, little chicken wing type thing here. How's that feel? Stress that here just a couple of times. The other way is to hook the elbow, distract the shoulder, and then internally rotate. How's that feel? Huh?
Feel that more, yeah.
You do that a few times.
How much time do you do this before somebody's pre-pitch or outing?
So it depends on what their routine is, right? So you want that to be right before they're about to go out, essentially, and start their thing. Start whatever their on-field routine is. This is going to be that first piece. So a guy may get dressed and then come in 45 minutes before a game, if they're a starter, for example. Come in, get dressed, stretch him if that's his routine, and then he'll go outside, start his own little dynamic movement stuff with the strength coach, and then start his throwing program.
Okay.
And go right into his bullpen and then the game. So you don't want too much time to elapse between the two things, essentially.
And then what about for relievers?
So for relievers, it's tough. This is where that professional model is good, because you always have a guy inside who, reliever, third inning, the reliever will come in and say, okay, my general time when I pitch is about the fifth inning, let's say. I'm usually a middle reliever. This guy's struggling right now. Let me come in and get my shoulder stretched. Comes in, gets his shoulder stretched, bam, you got it all set. In high school and college, it's tough. I mean, the best thing to do in that case, if you have an athletic trainer, is to have a table right by the dugout. And then just have, like I did that with the Cannons player a couple weeks ago. I said, hey, just whatever your routine is, just come find me, and then we'll just head out. I'll stretch you in between innings, and then we'll go back down. So, all right, so we'll go back to doing some ART of the bicep. So, scoot this way a little bit. So I'm gonna make it active as much as I can. So I'm just gonna pin it, and then you're gonna extend. Actually, come up a little further. Yeah. I'm gonna pin his bicep, and then he's going to actively extend his bicep extend the shoulder. Good. Come back, we'll do that a few times along the length of the muscle. Do it 2, 3 times, boom. Good. So now we fit that out. Is that your injured bicep?
No, no, we're good.
Okay.
Thanks.
I mean, it probably still will.
Yeah.
Yeah. So he's already got that mobility that he didn't have. You know, so we don't have to go too crazy when I get him prone and stretch his posterior cuff a little more. But I will anyways, just because it seems like that seems to be a problem spot. Other thing that I like to do is just stretch the forearm a little bit. So as you can see, he's probably missing a little bit of extension. I don't know if that's bilateral. If it is, then I won't go too crazy. Again, important to compare bilaterally for areas because you don't want to overstretch something that doesn't need to be stretched. Just come in. This is more the relaxation component. So there's obviously 2 different things that you want to basically assess. Does the person need length, or does the person just need to be sort of relaxed a little bit and prepared to go pitch? So if that's the case, then you just go, you know, through that motion a few times, just to stimulate the arm. All right, so I'll do that here, and that. Maybe do each individual finger just because it feels good, you know? Especially if you're a pitcher, constantly gripping the ball, forearm, all that stuff. Extensors here. And then you're gonna go prone.
Head down
Yeah,
here.
head down here somewhere. All right, so I'm gonna place his hand under his hip. Good. And we see that he's got some winging here immediately. So gives you a clue as to what maybe, gives you a clue as to maybe what you need to do. You can stretch this posterior cuff here, which is probably pulling that scap over, right? Creating a little bit of this winging. Or you could also strengthen those retractors to keep that down. So in this case though, I'm just gonna try and stretch that posterior cuff to increase some length. So before I even do this, what I'm gonna have him do is just a little bit of ART for that posterior cuff, right? So you're gonna go from this position, slowly come down, okay? So I'm gonna pin that musculature, find that, you know, teres minor, right in there, pin it. So do that along the length of the muscle there. Tender?
Mm-hmm.
Yeah. Good. Go ahead. And you can find, you know, as you get comfortable, you'll find spots in the muscle that need the most attention. So just for the sake of time, we'll just continue. So again, I've kind of hit that area. So now I'll just stretch that out. You should feel a stretch in the back of the shoulder there, right in the area that I was just kind of hitting. So now all I'm doing is stretching that posterior cuff, which from pitching, that eccentric trauma tends to tighten anyways. So now we're seeing, let it go. We're seeing that sit just a little bit better, right? Stretch it more. Okay, now scoot all the way over. And it's important when you're stretching a guy or a girl to understand that certain positions work for some people and some don't. So this is a prime example of that, where I'll basically try and do the same thing in 2 different positions. If the previous one didn't work, which it usually always does, I'll go to this one. So again, looks like he's got some some tightness posteriorly. So what I'm gonna do is just pin that scapular and distract as well as stretch out back. You feel that?
Mhm.
Let's do that a few times. Huh? Good. Then, to finish off, I mean, I'd like to have a bolster that, you know, if he's lying supine, I'd place on his back and then stretch his pec out in a couple of different ways. But since we don't have that, lie you back real quick. We can just stretch the pec this way, right? Which I usually do actually in the beginning of the routine when the patient's supine. So it feels alright. You're just generally tight. Yeah. So, and then that would pretty much be it. But again, it gives me a good indication that, all right, there's certain areas in his shoulder that need the most work. Should